strong clinical governance around how new processes or implementations or care pathways and how those things all kind of get built, how IT comes to the table, how everybody kind of works together to try to drive towards an outcome. Those processes already exist. Most organizations already have strong data governance elements, and think about how you think about how data is used within an organization, but also think about how data is going to be integrated with the long-term vision of trying to get to where they're trying to go. Organizations should leverage the functions that already exist versus trying to stand up something new to avoid that whole non-productive period. So if you think about implementing AI in a clinical space, leverage your clinical workflow, leverage your clinical governance processes, interject the elements that are missing in terms of folks that are thinking about that long-term view of what AI is going to look like for the organization, add them to that element versus trying to create something all new. And if you do that, you're going to be able to leverage the things that are working and bring in additional elements, and you're going to layer upon that, and you're going to drive the maturity of that in a certain way. AI is going to be so much part of everything we do within an organization. It's not going to be not just part of clinical, but not just part of rev cycle, or not just part of IT or administrative. It's going to be part of everything. Leverage the folks you have in the organization. We've spent a lot of time understanding how MIPS and macro, all those kind of things work, and how we stay current with what HHS's new rules and regulations are, and how we stay current with the new Medicare and Medicaid regulations, how we stay current with the payer regulations around things. We need to bring all those things we've done in those areas and continue to do them, and apply AI on top of that and integrate it into that workflow, not to create an entire separate organizational governance structure that's outside of all of that process, because it will take forever to stand it up. It will not be effective, and we're eventually going to bring it down back to that smaller groups of trying to drive towards accomplishing an outcome that's going to drive better patient experience.